Vitamin B6 may be one of the most underrated anti-inflammatory nutrients in the human diet. While it's commonly acknowledged for its role in amino acid metabolism and neurotransmitter synthesis, its ability to regulate inflammation, a root cause of nearly all chronic disease, remains largely in the shadows. Mounting evidence now shows that low B6 levels are consistently associated with elevated markers of inflammation and oxidative stress, including C-reactive protein, CRP, a well-established predictor of cardiovascular disease, metabolic syndrome, and even cancer. Yet, despite its potential, B6 is rarely spotlighted in the discussion around anti-inflammatory therapies. Instead, attention remains fixed on more marketable compounds like turmeric, omega-3s, and resveratrol, while B6, one of the most biochemically essential and cost-effective options, is mostly ignored. The active form of B6, pyridoxal 5-phosphate, PLP, plays a quiet but powerful role in immune and inflammatory regulation. PLP is involved in several pathways that directly modulate the production of pro-inflammatory cytokines, such as interleukin-6, IL-6, tumor necrosis factor alpha, TNFA, and interferon gamma, IFN-. When B6 levels are optimal, these inflammatory messengers are kept in check, allowing the immune system to respond appropriately to threats without tipping into chronic, tissue-damaging inflammation. However, when B6 is deficient, these cytokines often rise unchecked, leading to a state of persistent low-grade inflammation that erodes tissues and organs over time. Multiple studies have documented that individuals with low PLP levels consistently show higher concentrations of CRP and other inflammatory biomarkers. These associations hold true even when adjusted for variables such as age, weight, and chronic illness. In fact, B6 deficiency is often found alongside elevated oxidative stress, a byproduct of unchecked inflammation that damages DNA, lipids, and proteins. Over time, this contributes to the pathogenesis of diseases like cardiovascular disease, type 2 diabetes, rheumatoid arthritis, Alzheimer's, and certain cancers. The inflammatory terrain these conditions grow in is not random. It is often nutritionally mediated. Despite this, inflammation research and treatment strategies continue to overlook B6. In clinical settings, inflammatory symptoms are often approached with immunosuppressants, corticosteroids, or biologic drugs that block cytokines, especially in conditions like rheumatoid arthritis or inflammatory bowel disease. But these interventions carry side effects and do not correct the underlying cause of immune dysfunction. If part of that dysfunction is driven by a simple micronutrient deficiency, then patients are being exposed to high-risk therapies while a safer, foundational solution remains ignored. Cardiovascular disease is another area where the anti-inflammatory potential of B6 is largely overlooked. While statins are routinely prescribed to reduce CRP levels in patients with heart disease, there's little attention paid to the role of PLP in modulating these same markers. Studies have shown that individuals with lower B6 levels tend to have higher rates of atherosclerosis and vascular inflammation, even when other risk factors are accounted for. The mechanism is likely multifactorial. B6 regulates homocysteine, another cardiovascular risk factor, reduces oxidative stress, and calms inflammatory cascades. These are not marginal effects. They strike at the heart of the disease process. And yet, the medical system remains fixated on lipid levels and prescriptions, barely acknowledging this crucial vitamin. One reason B6 remains marginalized in the inflammation conversation is its lack of commercial appeal. Unlike designer drugs or patented compounds, B6 is inexpensive, non-patentable, and not particularly marketable. There's no blockbuster incentive to fund large trials that might cement its place in chronic disease management. The result is a self-reinforcing cycle. Because it's not promoted, it's not studied extensively, and because it's not studied, it's not promoted. Meanwhile, public health continues to chase down ever more complex solutions to problems that may, in part, be rooted in simple biochemical imbalances. Another obstacle is diagnostic blindness. Standard medical evaluations rarely include B6 status unless there is a specific suspicion of neuropathy or severe malnutrition. But inflammation-related B6 insufficiency is often subclinical, meaning symptoms are present, but not severe enough to trigger suspicion. People may experience fatigue, joint pain, stiffness, or general malaise, all of which can be easily written off as age-related or lifestyle-induced. The possibility that these issues are partially rooted in micronutrient deficiency is seldom explored, Even though B6 depletion is common in the very populations most affected by chronic inflammation, the elderly, diabetics, those with kidney disease, smokers, and individuals on multiple medications. Moreover, B6 is often depleted by the very processes it seeks to regulate. Inflammatory states increase the metabolic demand for PLP, which is used more rapidly as the body attempts to manage the biochemical chaos. The sicker the patient, the greater the need for B6, and yet, the lower the likelihood that anyone is testing or supplementing it. It's a downward spiral. Inflammation burns through B6, deficiency worsens inflammation, and the cycle feeds itself in silence. Thankfully, correcting B6 insufficiency is relatively simple. Moderate supplementation with P between 25 to 100 milligrams daily is safe and effective for most individuals, especially when balanced with other B-complex vitamins. Dietary sources such as turkey, salmon, sunflower seeds, bananas, and fortified cereals can help maintain healthy levels, though needs may increase during stress, illness, or aging. Unlike more aggressive interventions, B6 addresses inflammation by supporting the body's own regulatory systems rather than suppressing them. In summary, vitamin B6 is not just a peripheral nutrient. It is a molecular mediator of inflammation, a stabilizer of immune function, and a protector of tissues under oxidative stress. Its deficiency is silent, its symptoms vague, and its solutions inexpensive. And yet, it is routinely excluded from both research and treatment frameworks. This oversight costs lives, accelerates disease progression, and places countless individuals on pharmaceutical tracks that treat symptoms without addressing the root. If we are serious about reducing chronic inflammation, the common soil of nearly every major disease, we can no longer afford to ignore vitamin B6.